Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to the channel. Today we will continue our discussion about granulomas of the nose and paranasal sinuses. Uh, Before we have discussed the bacterial granulomas and fungal granulomas which are affecting the nose and paranasal sinuses, and the links for those videos is there in the description box, so you can check it out from there. And today we will continue with that discussion. So you are requested to like and share the channel, and also don't forget to subscribe. And this is the basic classification scheme which we are following, and this is the granulomatous rhinitis, you can say, which we are following basically. So again, the basic question is the same, and everyone will be having the answer for that. That after all, what is granuloma? Granuloma is a focus of chronic inflammation, which is consisting of a microscopic aggregation of macrophages that are transformed into epithelium-like cells, and these are surrounded by a collar of mononuclear leukocytes, principally the lymphocytes and occasionally the plasma cells. So this is the basic histopathological picture of a granuloma. And these granulomas, they can be classified according to the etiology, that is bacterial granulomas, then fungal granulomas, and all these we have covered already, and the links will be there in the description box. You can check it out there. And today we are concerned with that granulomas which are which their etiology, exact etiology, is not known. So this is the group which we will be talking about today, that is the granulomas of unspecified etiology, and this includes Wegener's granulomatosis, then is sarcoidosis, then is peripheral T cell neoplasm, which is also called as non-healing midline granuloma or Stewart's granuloma. This is actually a lymphoma. And then is another entity which we call as Churg-Strauss syndrome. So we will start with today with Wegener's granulomatosis. This Wegener's granulomatosis, this is an autoimmune condition which is characterized by necrotizing granuloma within the nasal cavity, and lower respiratory tract, with generalized vasculitis, especially affecting the kidneys, leading to glomerulonephritis. So just by from this disease, this definition, you will have a clear-cut idea that this disease is a systemic disorder and underlying pathology is vasculitis, and due to this vasculitis it can affect the upper and lower airway and along with kidneys, that is glomerulonephritis will be there. Its exact etiology is unknown. It could represent some form of hypersensitivity reaction to an unknown stimulus. It was first described by Frederick Wegener in 1939, and it affects the age groups of 15 to 17 years of age, and both sexes are equally affected, and it should be differentiated from T cell lymphoma and from large septal perforations in those patients who are victim of drug abuse. This necrotizing vasculitis, which is a basic histopathological feature in this particular disease, it affects small to medium sized vessels, for example capillaries, venules, arterioles and arteries. With necrotizing glomerulonephritis is common. The pathological hallmark is the coexistence of vasculitis and granulomas, and classically it involves a triad of airway, lungs and renal disease. So upper airway, lower airway and the kidneys are affected more due to vasculitis in this particular disease of unknown etiology. So antibodies reacting with the cytoplasm of granulocytes and monocytes have been demonstrated by van der Voort. Two main forms of anti-nuclear cytoplasmic antibodies have been demonstrated. One is CNCA, which is more specific for this Wegener's granulomatosis, and the other one is perinuclear ANCA, that is PNCA. The clinical features, they will depend upon that which part of the body is involved in nose and paranasal sinuses. There will be clear, purulent or blood-stained nasal discharge, severe pain over the dorsum of the nose with nasal obstruction, extensive crusting, septal destruction, and saddle nose deformity. Pulmonary symptoms, of course, they will include cough and hemoptysis. When kidney is involved, there may be oliguria and hematuria. When eye will be involved, it will be characterized by episcleritis or proptosis. Otological symptoms may include otalgia, hearing loss, and even facial nerve palsy. While in case of oral and pharyngeal involvement, there may be hyperplastic granular lesions in the oropharynx. So here you can see crusting inside the nasal cavity. Here you can see external nose deformity. Here external nose and orbit, both are being destroyed by this debilitating disease. The CNCA test is positive in 95% of the patients with generalized active disease. ESR is found to be elevated. Urine examination for red cells, casts, and albumin will be positive. Serum urea and creatinine will be raised due to glomerulonephritis. Chest X-ray will show multiple nodules or masses in 90% of the cases, and occasionally there can be solitary nodules. Biopsy from the nose will be diagnostic. Immunosuppressive therapy is the mainstay of treatment. Oral cyclophosphamide with a dose of 2 mg per kg per day for 6 months to 1 year, and prednisolone 1 mg per kg per day for 1 month will be tapered gradually. Then it can be trimethoprim and sulfamethoxazole in addition to immunosuppressive therapy can be prescribed. Then plasma exchange and intravenous immunoglobulin can be given. And of course, the necrosed tissue, surgical debridement is required for all that devitalized and necrosed tissues in case of such granulomas. And reconstructive surgeries like tympanoplasty or rhinoplasty or the tracheoplasty will be considered only when Wegener's granuloma is dealt with. So thanks for watching, and please don't forget to subscribe the channel.